Okay, we're live. Can you hear us?
You know you.
Oh, okay. Good afternoon. This is the Board of Health meeting on May 11th. This time is 12:35 or so. I'm Chuck Capetta, Pediatrician, Board of Health. Dr. Tony Storrs is away this week, so I'm filling in. And Dr. Stephanie Wolf-Rosenblum is here, too, in attendance, so it makes a forum for our voting discussions and passing of minutes and things like that. So bear with me if you can't hear me through my 6 layers of ass. Thank you. So there we are. How's everybody doing? Good?
Good, thank you.
Good. So let's see. Well, I guess I can call to order the meeting starting today. Thank you, Jim, for audio. First order of business is approving of the minutes from the April 2022 meeting, April 13th. Do we have any comments there?
Chuck, did you see the update that was
Yes,
distributed?
yes, I just got that one.
Okay, just a few minor clarifications that really don't change content, but for
Right. No, I thought it looked good,
I therefore move that the minutes be passed.
and I will second that. Is that how we do this? Or should I, do we know? Yes? Is that fair enough? Okay, so having done that, that's passed for the records. Approve the minutes. Okay, and we usually start with, if you'd like to read, our Director Bobby Bagley's here to take over the community service report or director's report. Do you want to read your?
Yes, and so I'll give our vision and our mission. Our mission is to promote, protect, and preserve the health and the well-being of the greater Nashua region through leadership and community collaboration. Our vision is to have an informed, safe, healthy, and resilient community where all people can thrive and prosper. And we subscribe to the following values of integrity, leadership, adaptability, and respect. And in accordance with these values, we plan to conduct this meeting with the expectation of respect to be shown to all staff, members, Board of Health, and to the public. And all comments made during our meeting will be delivered in a civil manner and be on topic related to our agenda items.
Thank you. So, is there a situational update, or? Yes.
There is, so I will give our COVID-19 numbers, and then I also have a few other updates going on as far as different diseases we're seeing in the states. So for starters, New Hampshire statistics, we've had 314,816 cumulative cases since the beginning of the pandemic. We currently have 3,902 active cases within the state. There's been about 2,492 cumulative deaths since the beginning of the pandemic. We currently have 97 people in the hospital that are positive for COVID-19, and 20 of those being treated with antiviral medications. For Nashua, we've had 22,162 cumulative cases with 250 active cases currently. The new case rate over the last 14 days is 475 new cases per 100,000 population. We have 154 cumulative deaths, and we have not had a death reported since April 22nd, which is about 19 days. As far as Nashua hospitals go, for St. Joe's and Southern, we have 12 COVID-19 positive patients, and 3 are being treated with antivirals. For our community levels, which is a new guidance that the CDC has put out, we are currently at medium level, which is based on new COVID-19 admissions per 100,000 over the last 7 days and % of staffed inpatient beds occupied by COVID-19 patients. For guidance, if you're at high risk of severe illness, talk to your healthcare provider about whether or not you need to wear a mask, stay up to date on COVID-19 vaccines, and get tested if you have symptoms. People can also wear a mask if they choose to, regardless of if they have symptoms. So for other disease updates, I wanted to talk about the pediatric hepatitis of unknown etiology that's been reported recently. So in Alabama, there were 5 cases reported, and all 5 have been positive for adenovirus. There's also been reporting in other countries like the UK, where there was 113 cases, and 53 that were tested, 40 were positive for adenovirus. and there are 13 reported cases in Spain. No patients have tested positive for any of the hepatitis viruses, and as of right now, it seems that most likely it's due to adenovirus. There have been other possible causes being mentioned, such as co-occurring infections, autoimmune disease, and reaction to certain medications. It is not due to COVID-19 because there's been no reported symptoms involving liver damage when someone's been infected with COVID-19. It's also not due to vaccinations. That's been some misinformation, disinformation that's been put out there. The patients in the UK that have this, none of them were vaccinated against COVID-19. And then lastly, I wanted to talk about the avian influenza that's also been reported. So this has mostly been in wild bird populations, but we did have our first case reported in Colorado. This person was involved with the depopulation of a sick flock, so they were in direct contact with sick birds. It's not a very high-risk disease for people unless they have other medical conditions. And this person was wearing PPE, but they weren't wearing the correct eyewear. So that's most likely how they came into contact. As far as New Hampshire goes, we've had one confirmed livestock case that's been identified, and wild birds have been tested in Stratford, Grafton, and Rockingham County, and those have been positive. And lastly, I just wanted to mention that this is spread through water reservoirs, so wild birds, especially fecal matter, it mixes in with water, and then you have livestock that are wading in water in backyards, and that's how they get sick. Guidance for this is to wear protective gloves. If you have livestock, make sure to wash your hands, and obviously keep in mind that if your livestock starts presenting illness, that you should report it. And that's all I have.
Comments or anybody? No, thank you. The pediatric stuff has been interesting. I
Yes.
think the AEP has they've kept us up to date, but I haven't heard any more than what you said here. So thank you. It's well summarized there, and but it's something to think about. About the second one, the avian, we're not talking pigeons or anything, or is that?
No, so mostly it's been found in Canadian geese and
Canadian
duck.
Okay.
So it was first identified in Canadian geese up in the Northeast. And then the first outbreak, I believe, for livestock was in Indiana. So it's making its way around. I think it was said that over 22 million birds have been affected by this so far, and it started in February. So, yeah.
Wow.
And it's starting to affect prices for poultry in the store and eggs as well.
Oh, really? Oh,
And,
wow. Okay.
yeah, and the case in Derry where they had to depopulate that, it was a sanctuary, and there was a large pond there, and so the wild birds would intermingle very easily with the domesticated birds.
Right.
And it was tragic. It was really hard. But where we do support some of chicken raising in more urban and suburban areas, we need to be mindful that those animals can come into contact with the wildlife. And so people should be thinking about just as was stated, that if birds seem to be sick, they should report that.
In a related question, last month, we spoke about contamination in pools and things that we were doing to make sure that pools were safe, vis-a-vis chemicals as well as pathogens. There are a number of places in the state that will be opening up now that have natural water, ponds and such, that are sometimes frequented by geese and ducks.
Absolutely.
Camps will be opening in another month or so. Can you please comment on what we do to watch those environments as well, given what you've just said?
We do not benefit from a natural source of water beach in Nashua, so we don't have a robust program here. However, I know that there are people in DES who do oversight of those community beaches. I don't know if there has been information that has been sent out yet, but I can certainly make sure that something like that happens. because it is a critical piece. I remember taking my grandchildren to Greenfield State Park one time, and everybody's in the water, and I'm looking at all the duck waste at the time and was horrified, just not thinking of avian influenza, but of other things. And so it is a real problem, and let me do a little bit of digging and communicating and see what we can do about that.
That would be great, and to have an update at our June 8th meeting would be great.
Sure.
Thank you.
Great question, thank you. And similarly, we had at this Board of Health, the chicken population that homeowners, do you have a tally of how many people can have chicken eggs? When we talked about that in the past, owners?
I think community development might have an idea. I think that there's a permitting process
Right,
now.
right.
So they would have a better idea. We can certainly talk to them as well. And I know that the waterways person, Deb Chisholm, has a good take on things that are going on
Okay.
in the community. Because we've been talking a lot about shared septic pumps recently and development, but I know that should be a good person to talk to about that and should check into it as well.
Thank you.
So
Thank you very much.
I got to make myself some notes before I forget.
Well, thank you, everybody. Lindsay, great job, as always. Thank you. Okay, so if we go to the department summaries, we have Director Bagley and her report, if she will.
Yes, thank you. So just start with our operational update. So the director, along with the managers, we continue to lead and support our staff in collaboration with our community partners to make sure that we can effectively perform the 10 essential services of public health. Community transmission, as you've heard of COVID, has been on the rise, and it's been since the end of March that we've seen those numbers go up. We continue to do weekly testing at the Division of Public Health and Community Services for staff health and safety. We no longer require masks in our office spaces, but when there is an occasion where there's COVID exposure, we do. So we are back at that point right now. We do have at least one case of COVID at our division and with some exposure, so we are wearing our masks again. We continue to operationalize all of our deliveries in recovery mode with the mitigation measures still intact. And so although it seems like things are shifting because things are sort of, I don't want to say leveling out because they're not, but the focus of how we're approaching response to COVID nationally and even statewide has changed. We still want to maintain some diligence, and so we're going to continue to push out messaging for people to make healthy and safe choices for themselves, since there are no mask mandates that are out statewide or citywide. And so we're going to continue to push out the information to keep the public aware of the numbers and, again, educate on their own safety. We continue to attend regular meetings with the Department of Health and Human Services in Concord to stay informed and up to date. So our FEP coordinator, our EPI, community health, public health nurses, and our manager still will participate in meetings as needed with the state. During the month of April, we participated in quarterly meetings with DHHS, which, again, we get our grants from, and so we have to make sure that we can give updates to them on our grant deliverables. And Kim will probably talk about that in her report, because we just did one with community health. Our community health improvement plan activities have initiated with our stakeholders and with our partners, so we're looking forward to the action items that come out of that, looking at putting together a task force so that we can address the 5 priority areas that have been identified. Our FAB reaccreditation activities are underway, so we submitted our application during April. We have until the month of October to get it complete and to get all of our information submitted. And we have domain captains, some are sitting right here at the table before you, that have been assigned lead roles for each of the domains, so we'll be busy over the next several months working on that. We've also completed our division demographic survey. That's a part of what we have to demonstrate in our accreditation for our workforce, and we will be pushing out a public health competency survey probably at the end of May. And we also got some technical assistance from the National Public Health Foundation on the public health competencies for public health professionals, because a new draft of that came out in 2021. And then as far as other operational updates, one last thing is that our executive leadership team will be doing some follow-up work with surgeon partners in our leadership development, and that will take place beginning in June. As far as a financial update, so we received some new funding for 3 new grants that are coming into the division. The Board of Aldermen just approved $60,000 of COVID immunization funds that came forth from the Workforce Development Grant to enhance vaccination efforts, and we received $283,000 under the Crisis Workforce Cooperation Agreement that will allow for us to hire a public health equity position, and we'll be able to pay for students. We'll be able to give them, it's not a stipend, but we'll be able to pay them, ones that aren't here to get credit, right? So if we take a couple of students on. And the $10,000 from the Charitable Foundation, I think we talked about that last month. And then there's a grant, the 2-year grant for our regional staff, so our behavioral health strategist, our FEP coordinator, our public health strategist. Funding, the proposal for that is due on May 23rd, so we're working to get that submitted. And then I gave some details a little bit more, as you saw in the report, on the staffing that's covered as a part of this, a little bit close to 1 million, a little over 1 million for fiscal year 23 and 24. And that's, again, to cover the regional work that we do. I did put in the policy update and the results from that, so hopefully you had a chance to take a look at that. The key policies, I believe Heidi's going to speak to 2 of them, 1268, 1270.
Oh, legislation.
Legislation.
I wasn't following you there for a second. Yep.
Yeah. So the legislative session is coming to an end, so an update was provided on the bills that went forth. And the 2 main ones that had to do with the health officer, so Heidi will talk a little bit about that. And then the other one that's a little disappointing is the one bill that was proposed for the vaccine registry didn't pass under one legislation, and they slipped it in under something else. And so it did pass, that there's going to be the opt-in instead of opting out. So, and that's going to require a lot of work for folks. As far as our community services summary reports, under substance misuse, the 10-year program services assessment has been completed. We still need to collect some more data. We just did not collect enough data to really be able to make an assessment that's going to give us some good information about the programs that were delivered over the past 10 years. We are planning to move forward on doing some mental health listening sessions with high school students, and there will be a mental health first aid session that'll be on, I think it's May 26th, right here in this auditorium. And the community health workers have been working in the community doing sessions with Cooking Matters, and they had their first group of community members graduate. They had 14 folks enrolled and 9 graduates came out of the program, so they're about to do another program. The first one was done with individuals who spoke Swahili, and so the next one is going to be for individuals who speak Portuguese. 2 of the community health workers did a 10-week program with National High students, and that was completed as well. So National High and Penn Jeff Middle School, and they're going to be doing evaluations of that to see how effective that program was for those students. Our epidemiologist, she gave you her report already, but she worked on developing a survey that will be disseminated to the staff on the competencies, and so we're looking forward to doing that. And also has been working with us on this, the Kresge grant that we have, and so we're moving forward with that, and we'll be doing some key informant surveys with some of our hospital partners, and that's already started, so that's good. And I believe that's it, and the only other thing I had on there was just the list of the boards and the committees that I've participated on during this month. So, and Oh, so this isn't my updated one because I had a other highlight and award recognition on the other one. Did you guys get that one where it said congratulations to, there it is. Can I read that, please? Thank you. Yes, so congratulations to one of our board members, Dr. Capetta, for receiving the Sandy Vance Skyok Legacy Award from the New Hampshire Children's Health Foundation for all of the work that he's done over the years in pediatric health. That covers a broad spectrum of oral health, nutrition, sports, and so I just wanted to make sure we made that acknowledgement. And happy Nurses Week to our public health nurses. And that's my report.
Thank you.
Thank you.
Thank you very much.
Thank you, Bobby. I just, again, want to congratulate Dr. Capetta for this award that recognizes exemplary and aspirational commitment or innovation toward improving the health of New Hampshire's children and families, and we know that you've had a lifelong commitment to that. So, well-deserved. And I know you don't do it for the recognition, but we are so fortunate to have your commitment. Thank you.
Well, thank you.
Absolutely.
I follow your lead, my friend. Thank you very much. Thank you. Excellent. And Sandy Van Scoyoc is a wonderful person. She and I have known each other for years, and she's a great role model, so, as all of you are, so thank you. Any comments on, excellent report, Bobby? Any comments? I had a question about because our office is doing the opting in and opting out registry now. So is it?
So right now, you automatically opt in.
Yes.
Unless you sign that you want to opt out.
Yes.
So Bill 1606 is what the bill that Bobby was referring to. That is changing so that it will be an opt-out automatically, and you will have to opt in. So it's putting another barrier
I
in
see.
place.
Okay. Yeah, that's not good. Okay.
No, it's not good.
Oh, gosh, okay.
And a great deal of extra work,
Yes.
and as we
Yeah.
heard from some of the people who testified,
Yeah.
it's going to cost quite a bit of money for them to change their software to be able to
Yes.
have it work the other way. It's going to be very time-consuming as well, so hopefully, with the next legislative session, there'll be, after a year of going through this, there'll be a change in that legislation.
So can I take back to our department that it's effective? When will this?
It has not been signed by the governor yet.
Okay, okay.
So it's still in that holding
Yeah.
period right, in that holding
Okay.
state right now, yeah.
All right.
Is there any way
Feel free to
for us
reach
to-
out to the governor.
Yeah.
Yeah.
He has not signed it yet, so
Okay.
it may,
I will push it back to our pediatric colleagues in the
Okay,
state.
that
So
would be
that's
great.
just would be
Yeah, have them all
a mess.
call.
Yeah.
Yes.
Yeah, because it's, right now, the process is very easy. The nurse
Mhm.
just says, we have a registry, we've done it for a year, and everyone, they explain what it is for schools. It's not to pass along to any Joe, Tom, Dick, and Harry. It's just isolated cases where the providers can get to know your children's health in the best way, hospitals, and it works nicely. I'd say probably 10% are opt-outers, 90% are opt-in, but if we now have to do it the other way, it's just going to be a lot more legwork and discussions.
Well, in addition to a lot of legwork and our tax dollars going to this
Yes.
particular process, from a public health perspective, it's really an issue for New Hampshire that we haven't had it right along.
Yep, yep.
And what we know is that the pandemic, for various reasons, has diminished the number of children that are vaccinated, both because people didn't get their regular, timed checkups, the children didn't, and because there has been a lot of discussion and drama around vaccination in general. And what will happen, and is happening in other parts of the world, is a resurgence of preventable disease. An example is polio. Another example is measles, highly transmissible diseases that cause lifelong disability
Yep.
in people that get it. And when you have information that helps you to know who has and hasn't been vaccinated, when an outbreak occurs, you can target those individuals or offer help to those individuals and families before they suffer the consequences, and it makes the public health process that much more efficient. So I do hope that we will all reach out to our colleagues and talk to, and see if we can influence the governor's perspective on this.
Yeah, that's going to be very important.
Well, thank you. No, I will reach out this afternoon. Thank you. Okay, well done. So next in line are our various community health reports. Thank you. Kim?
Thank you, Dr. Capetta. Kim Bernard, Chief Public Health Nurse and Manager for the Community Health Department in Nashua. Dr. Capetta, congratulations on that well-deserved award.
Thank you.
So just going to review some department highlights. Our COVID cases continue to rise, as we've heard from our epidemiologists. There's been a 207% increase reported since March, and this data we know is not inclusive of home testing, so we don't have an accurate number. So educated guess is that that is a lot higher than what is stated. We continue with COVID vaccine outreach to reach vulnerable populations. We hold weekly outreaches just targeting those vulnerable populations to try to get as many people vaccinated as possible. We have had our FY22 Q3 meetings with New Hampshire DHHS, as Bobby had alluded to, and our reports were submitted for our STD, HIV, and HCV and immunization program grant work, which we had very positive feedback from. Our contract was finalized with our 340B program. We are going to be starting to provide PrEP to qualifying clients at no cost, and we'll be rolling out this program this summer. So I'll have more information on that at our next board meeting as well. Awareness weeks that we've been active with, and this includes some marketing, and that'll be in the Health Promotion Specialist report. It includes marketing and outreach. STD Awareness Week, Infant Immunization Week, which to Dr. Wolf Rosenblum's point about trying to push out information on getting our children up to date on their vaccinations. So we've pushed out a lot of information surrounding that. Also, we participated in Public Health Week. We also had 3 nurses attend the Early Childhood Fair. It was held on a Saturday at Greeley Park. We provided information and education on lead, behavioral health, and immunizations. We currently are in the final stages of the HL7 implementation between our EMR and the State Immunization Registry. So I'll have hopefully some good news at our next board meeting that we're fully vested there. And what that means is that we don't need to double document. So we've been putting everything into our EMR and then also into NHIAS, which is the registry. We finally received our new lead testing kits, and we have restarted lead screening in-house and at our outreach activities. We have had some community health staff travel to the New Hampshire State House to show opposition for House Bill 1639 relative to youth risk behavior surveys and changing that to an opt-in. We also had one of our staff nurses submit a letter in opposition to Senate Bill 1606, the one I just referenced, about the opting in for the registry. And we also received a donation of waiting room furniture from a local company for our clinic waiting area. We'll be having an open house sometime in June, so everyone will be able to see our newly renovated space. Workforce development, we've had staff attending conferences surrounding SUD, immunizations, behavioral health, and homelessness. And we've also had several students in the undergraduate BSN program and the nurse practitioner graduate program from Revere University come through this semester. We just completed our round with students, and we'll be having more students come in the fall. And they've been great. As far as activities that I have been active with outside of that, I presented at St. Anselm Student Nurses Association Professional Nurses Night as a guest panelist. I've presented with several of our other nurses at the Nashua School District School Nurses Staff Meeting to reconnect regarding all of our community health services that we offer. And I also attended a virtual conference, the Association of Public Health Nurses. It was a week-long conference, which was really good. And the rest of our reports for our different programs are all in the following report. And if you have any questions, feel free to ask. Thank you.
Excellent. Comment? Stephanie?
Great work.
Great work.
Thank you.
And Dartmouth finally got their.
I heard, well, we
last
heard you
week.
got them, so then we were excited because we
Yeah.
thought we're going to get
Just
them next.
started 2 days ago, so.
Oh,
Manchester's
good.
had them,
Oh, maybe we
Hartford's
have them
getting
first.
So
Huh.
we'll see. Until
Great.
the machine breaks down in a week, we'll be fine.
Gosh, no.
Well, thank you, that's good.
That's exciting.
Yeah. Okay, thank you. Next, let's see, we have various reports from health promotions and. the
So
public
those,
health-
yes.
Those are just individual reports.
Those are included,
Okay.
so there's a brief
Yes. Okay.
report out on those, and then you have their full reports as
Perfect.
well. So you'll
Okay.
have one
Okay.
from our FEP coordinator, health promotion specialist, public health network strategist, will be in that
Yes,
packet there.
perfect, thank you. So then we get to move to wonderful environmental health, correct? And you're up there, Ms. Height.
Thank you. Thank you, Dr. Capetta. Heidi Pikakoka, Nashua's Health Officer and Manager of the Environmental Health Department. This is when we're going into our busy season, and things have started up steadily with a lot of our food service activities. Our failure rate is still pretty good. That represents a great deal of work, a lot of hand-holding within kitchens, a lot of education. This is one of the reasons I am very proud of the people who work in the field, and they have that perfect touch out there where it's not too heavy-handed. It's not, these are the regulations and I'm going to nail you for this, this, and this. They talk about relevance, they talk about what kind of impact it can have on the business owners, on the public's health, and I really appreciate the effort that they take in the field. I know that sometimes with a lot of these facilities, you think you're going in for an hour, but you end up spending a great deal more time, and I do appreciate the environmental health specialists' patience, their tact, and their professionalism in dealing with business owners and managers. So a lot of credit to them. But it's a balance and it's a real struggle. We still have to do our jobs, but we need to guide people on how to do the right thing. And with the cost of supplies, food, staffing issues are still there, and people don't necessarily think as much about going out to eat as they did before. So it's a troubled industry, and some people are thriving. We've seen a tremendous number of change of ownerships. So a lot of people are trying to break into it, and a lot of food trucks are in development. People had a time to sit back and think about what they might want to do. And so we've got more food trucks licensed than we've had before, and that takes a lot of hand-holding because each one is evaluated individually. So that's it for food service. We haven't had the number of school inspections this time of year that we can at some time. The high school inspections take a very long time. We still are committed to doing our child care and foster homes. We've had a few food service complaints. We're breaking those down specifically now so that they are food service, pool complaints, and other complaints. And it's still early in the season to be getting complaints about either swimming pools or abandoned pools. So there's more to come on that. We got our indoor pool and spa inspections completed for the season so that we're just in better shape to go into outdoor pool and spa season, which is very busy for us. And that's another service that we provide, is that we do microanalyses of all of the outdoor pools and the indoor pools. And those reagents have gone up significantly for us, and we have a small budget. And so we're having to kind of streamline stuff and see where we can cut corners in order to still provide that service. But it's just like everything else out there that, everything is expensive right now.
Is it a free service for the individuals?
Well, this is for our public pools.
Yes.
So we license them. It is somewhat taken care of in their license cost, but we also do conduct inspections and water quality testing that's more chemical in nature, poolside testing, rather than that. We hadn't expected the significant jump in the reagents. We do call alerts and suit alerts, and it's just,
But we don't charge for that.
we do not charge specifically for it.
So it's daunting to think about the increase in the number of food services that you have to inspect and license with all the trucks, to your point, and this, and the cost. Are other public health departments outsourcing some of these things? Do we do enough of a volume for us to get the right price on the reagents? And are there local organizations that might be able to decrease the amount of work you have to do and decrease the cost, or is that just wishful thinking?
Well, what we do is pretty specialized. I don't think that there's anyone in the state who does it exactly as we do. And the state pool program actually modeled their program after ours. And they don't do as much with Pseudomonas as we do, because we were always cognizant of what spa water can grow in it and how it can affect people. And I may have missed some of your questions, so you can rein me back in. So that's part of it.
Well, I didn't know if there are any commercial agencies that may be able to get a better bulk price if we have sort of a limited amount of tests. Just trying to think how to make it easier and less of a strain on the budget.
There really isn't anyone capable of doing that. And the only laboratory that does Pseudomonas in response to an identified outbreak would be the state public health lab. Really, it's not picked up locally anywhere within the environmental testing labs. They haven't grabbed that. And it's most of the pool testing that's available is for the pool owners, like a homeowner, and how do I balance my pool chemistry and things like that. So the industry hasn't really promoted much to do with the health and safety aspect of pool testing. And a lot of times they can be selling a specific product that we don't necessarily approve of as well.
Okay, thank you.
Bobby, did I answer that sufficiently, or is there anything I should add?
And I think as far as like any other health departments, I mean, it's Manchester, it's Nashua, and anyone that's certified in pool inspections, they do it based on a particular protocol, and so everybody's probably paying the same for the reagents when they do get them.
Right, and but Manchester doesn't do the water, the microanalysis that we do. Bedford and Merrimack inspect their pools. They are self-inspecting communities for their pools, but they don't do anything other than the poolside chemistries.
So it's unique.
But it's valuable. It's really good information, because when you don't know what's going on, you can't exactly see the microbes lurking there in the water. Sometimes you have a pretty good idea, but you've got to know for sure. Let's see. Oops, glasses back on, sorry. Rabies has been pretty quiet. We're now, you'll see on our revenue that we are listing our septic revenue. That's a little percentage, but our pool revenue, the pool licenses expired at the end of April, so we're just starting to see those come in. And they're not all done, so you'll see that bump up even more. And during COVID, it was really hard to figure out what to charge pools that did not open, and it really wasn't fair to extend the license when they had no intention of opening. So the revenue has had some pitfalls, and it would be nice to just kind of normalize everything for a bit. Okay, as far as our legislative updates, as Bobby had discussed, both House Bills 1272 and 1268. 1272 was deemed inexpedient to legislate. And I was actually a little disappointed that DHHS had not come out in overt opposition to 1268, because I think that their voice really mattered and helped push the decision easier to inexpedient to legislate. So that ended up being referred to interim study, where it kind of sits, but what did happen was with this other bill, they made what is, I guess, is commonly called the poison pill, where they added some of the language to the Affordable Housing Development Bill to incorporate that kind of decision-making, either in the towns or in the cities. That has not played out yet, and we will keep you updated as to how it does play out, but it's kind of the gift that keeps giving. And it's very troubling what's happened with politics, and just trying to do the right thing doesn't seem to be trying to do the right thing at times. And it's very challenging. One of the things that I would like to mention, though, is that both Ren and I sit on the New Hampshire Health Officers Association, and we have recently retained New Hampshire Municipal Association to track bills for us. And I think that they uncovered one specific to vaccinations that we weren't watching before, because there are so many of them. It's very arduous to actually read them all through and figure out where they're going and what they're doing. But they've been invaluable to New Hampshire Health Officers Association, and I think our division now as well, when it comes to getting a better grip on things, because they're attorneys, this is what they do. And so I think that's money well spent for the organization, and I appreciate the efforts. Lots of trainings. Our staff, we've been trying to move toward some credentials within the department for the environmental health specialists and most of us on staff. And so we've taken advantage of some of the remote FTA trainings because they've been free of charge, but they are a commitment. They are sit all week at your desk with headphones on, and they expect you to be present and on camera at all times. But the trainings have been really good, and heard some good thoughts out there, and also kind of reinforced that we're doing things the right way. I know that a lot of time was spent at the special events course, and yeah, it really echoed some of the stuff that we do in-house, so that was very gratifying. What else? And I have here that both Ren and I testified in opposition at the Senate hearing for, I always get it mixed up, 1268. But it's interesting to see the process, and it's really awesome for people who are new on staff. We'll try harder to get them up to Concord to see what the process involves and how convoluted it can be. and what kind of surprises and pitfalls may be there as well. We have created pool inspection SOP because we are trying to become compliant with DES's pool program, which is new to us, and it's kind of ironic, as I said before, that they modeled their program after ours, and after the Legionella in Hampton, they have really boosted their efforts and gotten a lot stricter about things. And I can understand that because they didn't know that that spa existed, and that's been a problem for a long time. But there's also a single person full-time overseeing the public bathing facilities in the state. And we also attended the self-inspecting quarterly meeting. The other thing that I wanted to add is that we work very hard to train up our environmental health specialists, and we're looking to add the credential for the registered environmental health specialist. And I always screw up this acronym, so forgive me ahead of time if I do. The Certified Professional for Food Safety is another NEHA, National Environmental Health Association credential that we're trying for anybody who does food service in any way. But we had proposed going to an environmental health specialist 1 and specialist 2 position, and that hasn't played out entirely, but we would like to see that we are encouraged to pursue that level of education and credentialing, and it's tied into our accreditation and our workforce development.
Well, amazing. Wow, wow. Well, you and Ren and your whole department always do the right thing, so never
Thank you.
apologize for towing the line and doing what you're doing. It's phenomenal. Wow. And I love how you highlight, I like how it flows now. It's much easier to read.
Oh, excellent. It's
Yes.
good feedback. Thank you.
It is, it's nice.
I think it's much leaner.
Much
And it's
leaner,
just,
yes, yes.
for me, it ends up being talking points. Thank you.
Thank you.
Just a quick comment, echoing and building on what Dr. Petta said. It is just really appreciated that you and Ren put yourselves out there up in Concord. It's not easy. Having testified in Concord, I know we both have. And certainly in this interlegislative period, if there are people who we can help educate, I mean, we're not a political organization, but we certainly do participate in public health education. It would be helpful to know that. And the other thing that really strikes me about today's meeting is that we're into the 3rd year of the pandemic. And the resilience of this department is demonstrated by not only are we using this opportunity to, we are not using this opportunity as a breather, but to hear you continuing to advance the department and advance the goals of public health in our region is just really inspiring, and I just wanted to say thank you.
I think that's across the division.
Yeah, that clearly, yeah.
Thank
Team
you.
effort. Good job there, Captain. So excellent, excellent. On a one note, how do you define a vendor? Because there is a certain vendor over at the Nashua Airport that has a Subaru that sells certain things out of the car.
A what?
Uh-huh.
A car?
Uh-huh. So I just wanted to bring that up. I didn't know if that was something that gets licensed, and
It should be
We'll talk
licensed.
offline, but just as a.
Yeah, if you could,
The food trucks I heard, but this was an interesting sight I've
This
seen
is
for 2 months.
this does sound interesting.
oh,
Okay.
that sounds very unsafe.
You may have to take a little ride.
Yes.
More later, because I go by the airport every day.
Okay, if you can grab a picture, that would be
Okay.
1,000 words.
Okay,
We can
thank you.
just go by and take a little
Yeah,
ride.
absolutely.
Thank you.
Thank you.
Yeah.
This is how people get sick.
But see, it's a team effort, right?
Yes,
Thank you.
thank you. Okay, now, boss, we're on to the Welfare Department report.
Thank you. Bob Mack, Welfare Officer for the City of Nashua. Good afternoon. Just reporting out on the welfare activities for the month of April. You can see in the report, there was a slight increase in expenditures compared to last year at this time. We're still, however, seeing a pretty low request for a lot of assistance for rental assistance, primarily because there's still a good amount of funding out in the community, primarily being offered through the Community Action Program, Southern New Hampshire Services, managed by New Hampshire Housing Finance Authority. I think they still have a significant amount of money left to continue to work on, and they continue to process applications. A lot of what we do is we assist people in a gap between the 4 to 8 weeks it takes for them to process applications. So we're still seeing some requests, but it's not nearly what we've seen historically prior to this funding being put out in the community. So we've also, I don't recall if I had mentioned at the last meeting, the New Start program, which is a utility electric assistance program that we've been trying to get a lot of applicants signed up for, so they can get some forgiveness on any past due bills that they may owe if they qualify under a hardship category. So we continue to work with Eversource and with the clients accordingly. So you can see the percentage of people that we're actually getting direct aid through our general assistance program. That percentage is down, again, because of these reasons I just mentioned. So we continue to try to assist some folks in temporary emergency motel placements if there's no shelter available for them. We work closely with the shelter programs. We've also stepped up some work with the outreach teams. We've had a couple of meetings with DPW, police, fire, environmental health, public health, to look at the encampment situation. And as the weather is getting nicer, people are out in the community more and they're seeing things. A lot of it could be left over from last year. Some of it is new established encampments. So working with DPW and risk management to get some of those things cleaned up, and working to get the message out through the outreach workers to communicate with those staying in the encampment so they're aware that these things are taking place and they're not surprised and they don't lose their belongings, if you will. So we'll continue to meet on that as needed. A couple other things, the Greater Nashua Continuum of Care, this past meeting, we had present some representation from the hospitals and some healthcare providers talking about services for the homeless in our community and appropriate referrals and primarily discharges from hospital facilities to homeless shelters. The shelters did note that they had an increase in the number of folks that were requiring day privileges, because typically in the daytime they're expected to go out and complete certain requirements, whether it's job search, apartment search, what have you. They've seen a number of folks that have different medical needs, some older folks, so they're trying to keep tabs on that and track that and work. We're going to establish a subcommittee to work closely with the hospitals in particular to make sure that the appropriate services are in place if people are being discharged and getting to shelter programs. So that's some other activity that's going on. And we also did a landlord survey. I don't know if I mentioned this at the last meeting. We're trying to look at the number of landlords that will actually accept Section 8 and housing choice vouchers because of the low vacancy rate. There have been a number of people that are designated as chronically homeless that are eligible for vouchers. They have vouchers in hand but can't find apartments. So we're trying to look at, are there some sorts of incentives that may allow landlords or have landlords be more willing to accept these housing choice vouchers. And one of the number one issues of concern is some additional funding to address any sort of damage or repairs beyond a security deposit. Because I think what they find in some instances is people will, when they do vacate units, there's a lot of damage and it's above and beyond what a normal security deposit would cover. So those were one of the things that was identified as a potential incentive. The challenge is, where do you come up with money for that sort of thing? So that's another topic of discussion that's being looked at the COC level to try to identify potential funding sources. There may be some through community development or urban programs, but we have to work with them to see. A lot of that money is HUD money, and they have specific restrictions as to how you can use those funds. So kind of some works in progress, if you will. As far as fiscally, we're in good financial shape as far as our general assistance budget. We've expended about half of our general assistance budget, and we got about 2 months to go. So I think we'll be in good shape there and should be returning money back to the city on expended funds. I don't know if there are any questions.
No, great job. Thank you for all that you do every day. So with the vouchers, I mean, I don't have any sense of numbers. Is that can you share on how many people are using them or could use them? Or?
Harbor Homes basically manages the chronic homeless vouchers.
I see.
And they had about 30 some odd tenants or clients with vouchers in hand, if you will, that just can't find apartments to rent. And when you have like a 1% vacancy rate and you get a lot of people vying for one rental unit, I think one of the other things that the landlords noted on the survey was they're looking at income history. Now, actually, one of the case technicians was working with a client, and he said, well, I have this voucher, I just can't find a place. And he doesn't have a job. And so part of what she was talking with him about was, if you're not employed, the landlord's going to look at how are you going to sustain utility bills and things like that. It's not just about getting the rent paid, it's about sustaining the living unit. And so those are some issues. So focusing on employment supports and things like that are also important. So I hope that answered your question.
Perfect. Thank you very much. Thank you. Beth?
Yes, I know that we're getting towards the end of our allocated time, but I am concerned about next year. And I know we discussed this before. There was a lot of assistance, and a lot of that's going away.
Right.
And we have seen what's happening with the economy and the costs of the energy and fuel and things.
Yes.
And I know that, I see the reports going to the alderman body. I know that's highly valued to keep them up to date, a situational awareness on COVID. I just hope they also have a situational, awareness around the people that, you serve in this department, because I worry that next year's going to be rough.
Yes.
And it's great to return money to the city, but I also want to make sure we have an adequate budget for next year. And I have just 2 questions relative to things that can be done. One is, in today's environment, a number of the hotels are not fully occupied. And I know in the past you've mentioned to me how that sometimes is also a fraud situation. But I don't know if there's ever a possibility of providing, more long-term housing, temporary long-term? You know what I mean? I guess you would call that short-term, but housing at, a facility like that. And then the other thing is, in today's environment, there are a lot of people that want to either pay back the assistance they've received or pay it forward, but don't have funds to do it. But they're more than willing to roll up their sleeves. And I just heard a really interesting presentation from Habitat for Humanity, how they use volunteers. And I don't know if, Harbor Homes or other area agencies are in a position to rally groups of people that maybe their commitment is that when somebody leaves one of those units and is not in a position to leave it, without making any judgments, is not in a position to leave it in the condition they found it, whether there are groups that could commit to the landlords through various agencies to do some restoration there that might ease that tension. Just an idea.
No, that's an interesting thought there, an interesting idea. I believe that some organizations do have their own maintenance teams, and I believe they may offer to do some of those types of things and go in and do the repairs, if you will, and paint or do whatever. So that's another option. As far as the fiscal concern for the upcoming year, I think that's a legitimate concern when some of these programs do go away. This has been conversation amongst the Welfare Administrators Association that, we got to be ready for when these stop, and then people are starting to come back to see us for assistance. When we did propose our increase in the financial standards recently, a couple months ago. I went in front of the Board of Aldermen to propose the increase in the financial standards, and they've had a similar concern, and even since that time, the cost of things have gone up. So, so we are aware of that. We did propose a modest decrease in the general assistance budget for the upcoming year. We do, however, still have the Welfare Trust Fund, if we need to tap into that, which has about $370,000, give or take. Please don't quote me on the exact amount, but it's well over $300,000. That is an expendable trust fund that's there in case we run into an overage, because according to the state statute, we cannot say we're out of money, so we can't help you. Municipalities are not allowed to do that. If people qualify and they're eligible for the assistance, we need to find a way to provide that, which happened the 20-some-odd years ago when I first started in this position. The city was in that financial position. So we have taken some steps since that time to make sure we have some buffer and a safety net, if you will, to our safety net for the general public.
Thank you very much. Appreciate it.
Certainly.
I love that idea, and it just thought of me for, like the Girl Scouts, Boy Scouts, I mean, all the Eagle Scouts and the girls equivalent, you know, all have projects they have to do. Would they go to trips to do the X, Y, and Z, build bridges? Why couldn't they, under the direction of a dedicated adult, you know, have these as opportunities to throw it out there at some point? I think there needs to be layers beyond that, but other volunteers, the Youth Council, the Boys and Girls Club would be, they've heard some of this, what we're hearing today, I think would be heartfelt to say, hey, why can't we just do our little bit?
Yeah.
So, thank you. Great, great. So any other comments, guys? Team? So we'll close officially. Any last, before we go to public comments? So that concludes the official meeting, and opening up to public forum. We don't see much. Hope you're listening online. So thank you, all that might be listening. So we'll bring it to the conclusion to take a motion to end today's meeting of the Board of Health.
So moved.
Seconded, and here we go. Thanks, guys, for putting up with it.
Thank you.
Thanks, everybody. Great job.
Everybody for all your great work.
Thank
Thank
you.
you.
Thank you for the support. We appreciate it.